Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
You know, every year going back to school is a time of transition and can be challenging. It can be exciting, but it can also bring on some behavioral health concerns for kids.
Students will soon head back to class, and this year will bring on new challenges. In today's Healthier Together, we're navigating back to school mental health and how parents can support their students all school year. To make sure kids are ready mentally, we need to make sure they're ready physically. Dr. Mike Franz with Regents Blue Cross Blue Shield of Oregon says to start with the basics: exercise, healthy nutrition, and sleep.
And there's this bidirectional relationship between what we do on the physical health side and the behavioral health side.
First, physical activity. Make sure that kids and teens are getting 60 minutes of some sort of physical activity every day. Second, nutrition. Healthy food supports a healthy body and mind. Dr. Franz says nutritious meals and snacks start when parents are at the grocery store. And finally, there's sleep. Getting enough sleep is crucial for students, but it's trickier for teens. Dr. Franz says they have a different biorhythm, which makes them want to go to bed later and stay in bed longer.
Yeah, and I'm sure the parents of teenagers out there this summer know what I'm talking about. Unfortunately, that doesn't match with our school schedule. What we need to do is kind of artificially advance the sleep cycle.
To help your teen gradually transition to that earlier school schedule, start now. Have them go to bed 15 minutes earlier and wake up 15 minutes earlier every day until school starts.
And a good way to do that is really to get the lights down, certainly close the shades early. That allows the melatonin to start being secreted in the brain, which helps with sleep. And then in the morning to open those blinds right away, get a bright light in the room. That actually shuts off the melatonin secretion.
When it comes to behavioral health, it's really important to just check in with your kids. Ask them about how they're feeling about the upcoming school year and how they're handling the transition once it arrives.
Let your child lead that conversation. Ask open-ended questions and then give time for them to talk. I like to use the acronym WAIT as a parent, even with my own kids, and that stands for why am I talking? And that reminds me as I start to maybe get into my own story or how I coped with my childhood or school stress, to think, hold on, this is about them, it's not about me, so let's give them an opportunity to talk about that.
On the flip side of that, it is important to normalize anxiety. Some self-reflection with your children can be helpful.
And we want to let our kids know that we as adults get stressed when we have transitions. It's also challenging. It doesn't always go perfectly, and that's okay.
Of course, the pandemic has had an impact on what school looks like to students. From classes over Zoom to hybrid learning, students have had to constantly adjust, and they've suffered scholastically and socially.
Many children are behind academically. They lost some time, and they're struggling to catch up. The schools also are beginning to go back to their previous demands and rigors of academics, the tests, the papers.
Remember to support, listen, check in with them, and have open conversations about anxiety and stress. If you're concerned about your child's behavioral health, talk to your primary care physician. We'll bring you a new Healthier Together segment each week here on KGW. You can find more stories on kgw.com under the Healthier Together tab.